Hi, it's Dr. Brenda Heinecke over at Revitalize Physical Therapy. This is part 3 of our prenatal series, so you can check out part 1 and 2 on our YouTube channel if you missed it. On the pelvis here, when we talk about perineal massage, there's a lot of pictures out there on the internet that show kind of these crazy things. Really what you're doing, these are kind of your most superficial muscles on the side, pelvic floor muscles here. If I were to take this part off, this is all deep pelvic floor muscles. So when you're talking about doing these stretching, sorry, my model's a little broken, you're really talking about the superficial muscles. So women, maybe you've heard of like the ring of fire is kind of a term, or when people have any kind of vaginal tearing or an episiotomy where they tear through these muscles here, that's what we're trying to prevent. So some of the images online kind of show like this weird pulling clockwise motion. I think sometimes that's a little aggressive. So a much easier way is if you're thinking of, thinking of the vagina as the face of a clock, you're really working the whole bottom half of the clock here. So from 3 o'clock to 9 o'clock, working around. And you can try this on your own. You can recruit help. You can always use like a tampon applicator if it's a little easier. But what you're doing is basically just hooking in only about to the first knuckle. So it's a little superficial, and you're just going to gently pull. So say we're pulling here to 9 o'clock, and you're just holding 30 seconds to a minute, and then you kind of work to 10 o'clock. I'm going the wrong way on the clock, sorry, I'm looking at it upside down, but you get the idea. You're gonna work down and around. Most of the time, this area right here is gonna be probably like the tightest or most uncomfortable. You might feel some burning pain. If you do, hold it a little longer in those areas because that's where it needs a little more stretching. And it's just gentle, so it shouldn't create pain. If it's painful, back off. You're probably pulling a little too hard, and it shouldn't be like so bad that it's unbearable. So it's just gentle pressure, and you're just holding, working that clock face. But this can really help kind of prep the tissue to help expand so that it helps minimize tearing and trauma to these muscles when you're delivering. So if you're pregnant right now, getting ready to deliver, a lot of times we have our moms here start these by like around 32 to 34 weeks to really be working on it, depending on the person. If they've had kids before, have a lot of scar tissue or something, we tend to see them as physical therapists maybe a little earlier to help break that up, and that would be something different than what I just showed you. So just keep that in mind if that sounds like you. Otherwise, these stretches you could do at home a couple times a week is fine. So try that, and really help minimize trauma. If you're not sure or you have other questions, it's always something that we can help with here at Revitalize, and we'd be happy to kind of, even if it's just something like teaching you the proper way of doing it so you can do it at home. We do that quite a bit. So if you have questions, feel free, comment on the video, shoot us an email, reach out to us, and we'd be happy to talk. So hope this helps, and hope you can watch all 3 parts of our series and really take a lot out of it. So thanks for watching, and probably next time I won't be pregnant anymore. So again, this is Dr. Brenda with Revitalize Physical Therapy.